Does Joe Biden have Parkinson's disease? And why do we care? What is Parkinson's disease? Is it a disease of movement or is it a form of dementia? There's a huge difference. If it is a disease of movement only, then we are less concerned about the effects of this disease on our president. However, if it is a disease of cognition, such as dementia, then we are very concerned. In today's video, we will discuss what Parkinson's disease is and why it is often a dreaded diagnosis. What can we do to prevent or to mitigate it? And finally, we will discuss an amazing connection, amazing discovery between Parkinson's disease and our gut. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and a functional medicine certified physician. Before we delve into the world of Parkinson's disease, please like, subscribe, and share. So let's get started. Parkinson's disease is a chronic and progressive neurological disorder. When we think of Parkinson's disease, we think of abnormal movement first. Yet, abnormal movement is only a part of this disease. There are two types of symptoms that are characteristic of Parkinson's: motor and non-motor symptoms. Let's look at motor symptoms first. A very common symptom of Parkinson's disease is tremor. Parkinson's tremor is significant for involuntary shaking, when part of the body shakes without person trying to move it on purpose. It happens on its own. Parkinson's tremor starts in one hand or arm, and it can spread to other part of the body over time. There's also what is called a pill rolling motion. The tremor in the hands may look like the person is rolling a small pill or object between their thumb and fingers. Other interesting points about this tremor are that Parkinson's tremor usually happens at rest and disappears with action. For example, the tremor can decrease or go away if the person is starting to do something, such as holding a cup or writing. Also, tremor increases with stress. I'm sure you don't find it surprising. The tremor mostly affects hands and fingers, but also can affect arms and legs, as well as chin, lips, and jaw. The head tremors are less likely, but they are occasionally seen. The impact on daily life is difficulty with fine motor skills, such as buttoning a shirt, tying shoelaces, or writing. Also, there's of course a social embarrassment, as affected patients may feel self-conscious about this tremor, and that impacts their social interactions. Another telltale sign of Parkinson's is rigidity, that is translated into muscle stiffness that can affect any part of the body, causing pain and limited range of motion. The next sign is bradykinesia. Bradykinesia is slowness of movements that makes simple tasks difficult and time-consuming. Along the same line, another motor sign is postural instability, when you have impaired balance and coordination that can lead to frequent falls. Let's look now at non-motor symptoms. The first one to go over is cognitive changes, and they can range from mild cognitive impairment to dementia at later stages. They're often accompanied by mood disorders, such as depression, anxiety, and apathy. Also, sleep disorders, such as insomnia and excessive daytime sleepiness. Another important one is autonomic dysfunction, which includes orthostatic hypotension, which means that your blood pressure drops when standing, bladder issues, and constipation. And we will come back to constipation later again. What is the pathology behind this devastating disease? The main issue in Parkinson's is the loss of dopamine-producing neurons in a part of the brain that is crucial for movement. Also, there is a presence of Lewy bodies. Those are clumps of abnormal protein deposits that are mainly found in the brains of Parkinson's patients. Interestingly, there's also a Lewy body dementia. That is another type of dementia where Lewy bodies are found. In fact, the great Robin Williams was diagnosed with Lewy body dementia. Lewy body dementia is quicker and more aggressive in terms of the onset of cognitive decline compared with Parkinson's. A very important factor is that not all patients with Parkinson's develop dementia. What is the reason for development of this disease in general? 10 to 15% of Parkinson's disease patient inheritance is due to genetically inherited pattern. So 10 to 15% is genetic. Now let's look at environmental reasons that predispose to this disease. Some of them are exposure to pesticides, exposure to industrial chemicals such as trichloroethylene or TCE. It is used as a solvent and it can be found in groundwater. So the use of well water is a risk for Parkinson's. Other risks are living in rural areas, high consumption of dairy, and decreased level of vitamin D. So don't forget to take your vitamin D. Who is the typical Parkinson's patient? It is usually an older person, however, not necessarily an elderly person. About 25% of people develop Parkinson's before the age of 65. Males have higher risk than females with the ratio of 1.4 to 1. What are the protective factors for Parkinson's? Believe it or not, cigarette smoking is protective. It is strange because cigarette smokers, they seek dopamine. It's a dopamine-seeking behavior. While in Parkinson's, we have depletion of dopamine. It's not clear how that happens. Other protective factors are caffeine, exercise, ibuprofen, use of statins for cholesterol. As to the treatment, conventional treatment for Parkinson's disease includes medications levodopa, carbidopa. They increase dopamine in the brain and they're mainly used to diminish symptoms. So now we're getting to the exciting part. Emerging research has shown a gut and brain connection in Parkinson's. A common and early non-motor symptom in Parkinson's disease, often preceding motor symptoms by many years, and I will repeat that, preceding by many years, and that symptom is constipation. Let's unpack this gut-brain axis, gut-brain connection. The gut-brain axis is a complex communication network between our central nervous system, we call it CNS, and enteric nervous system of the gastrointestinal tract, that is called ENS. Remember those Lewy bodies, the abnormal proteins that aggregate in Parkinson's disease? These Lewy bodies are composed of what is called alpha-synuclein proteins. A recent stunning discovery has shown that these proteins are found in the gut. Vagus nerve is one of the main nerves of our body, transfers these proteins from gut to the brain. In fact, people who had their vagus nerve cut in a procedure called vagotomy are protected from Parkinson's disease. Along the same lines, disbalance in gut microbiome has been observed in Parkinson's patients with reduced levels of beneficial bacteria and increased level of inflammatory bacteria. Additionally, there has been an observation of leaky gut that is also associated with Parkinson's. What can we do to prevent this disease that essentially has no cure? We should try to restore our gut flora by incorporating probiotics and prebiotics. The goal is to reduce the gut inflammation. Dietary interventions are very important, such as a diet rich in fiber and anti-inflammatory foods. And those are very important for modifying gut microbiome and obviously improving Parkinson's symptoms. More of experimental developments are fecal microbiota transplantation. Yes, it is what you think. It involves transplanting fecal bacteria from healthy donors to Parkinson's patients to restore their gut microbiome. Pharmacological approaches entail drugs targeting gut inflammation and reducing gut permeability, essentially fixing the leaky gut. Parkinson's disease is a serious disease with no cure, unfortunately, but a lot of research and a lot of potential. Eating a lot of fiber, taking vitamin D, taking probiotics and prebiotics is helpful. So now let's go back to President Biden. Of course, ethically, it is not right to diagnose somebody by just watching them on TV without having the results of their cognitive tests, or in general, without being their physician. I call it the back alley medicine, when you make a quick conclusions without having a complete data. We will have to see how everything unfolds, and hopefully the public will have an explanation for his cognitive decline. Meanwhile, thank you so much for watching. Until next time.